Good morning, all of you amazing and beautiful souls. We're so glad you could make it here today with our live meeting. And if you're watching this in YouTube or in our classroom, we welcome you and hope that you gain some amazing information from our class today. All right, so before we get started, let's take a moment to just ground ourselves and prepare ourselves for a meeting and to learn. Take a few deep breaths. Just move a little bit. If you feel any tension in your shoulders, your neck, take another deep breath. Hold it. And when you blow out all that tension. Just feel the relaxation flow over your body. Take one more deep breath. And as you blow out, relaxation and focus with that intention of learning and paying attention and being focused today. All right. So today our meeting is about subclinical diagnosis because I've had a lot of questions about that. And I want to welcome each and every one of you. We're going to explore subclinical diagnosis and how holistic health approaches subclinical diagnosis. We'll focus on identifying early signs of imbalance and proactive root cause care. And that's what we'll be discussing today. So I'm going to make my slide presentation a little bit bigger so that you can read it as we go through. And we'll go to our first slide. I can get it to move. There we go. You don't want to move today. So the first question I have, and you know, this is a big question to understand what we do as a holistic care provider. What is subclinical diagnosis? I say that word a lot. Well, health conditions are present, but when health conditions are present, but not producing clear symptoms or not producing clinical diagnostic lab expectations. Okay. So subclinical means that there's something going on beneath the surface before traditional medicine can actually call it a disease. It's kind of like our body is whispering. It's like, I just don't feel 100%. And ladies, I know you've had this feeling before. I just don't feel 100%, but when I go to the doctor, everything is okay. All my labs look fine. So there is something going on, but clinically diagnosable symptoms, clinical, they're not able to identify any diagnosable symptoms. I just don't feel good enough, or I don't feel normal is not a diagnosable symptom. We can't really tell what it is. Often we can't detect these symptoms in a lab test. It's not obvious. Sometimes we can find lab tests that show subclinical, but we don't have any symptoms. Sometimes we have symptoms, but the labs are coming back normal. So there's kind of two different situations that go on. Sometimes these little symptoms or subclinical lab tests can identify early dysfunction or an imbalance that's going on in the body. So some of the key characteristics to look for is some of them are detected through blood work. Some are detected through imaging or functional testing. a person may feel fine, but still have, you know, a subclinical issue, not a diagnosable disease. Some people will have vague symptoms like, I just don't feel good. I don't know what's wrong. And some people, there's just not enough evidence for a diagnosis, but they know that they're not feeling great. My labs are normal, but I still don't feel good. Subtle symptoms, again, is your body whispering and saying, something's wrong. Pay attention. Um, so some examples of subclinical conditions. And I'm going to add, you know, these examples show that you don't necessarily have to be in crisis to be out of balance. And there are lab markers that doctors can do, and then there are markers that are labs that we can do as well that are more on the holistic side. So some that are done by the doctor, and most of you have maybe checked this, we have in hypothyroidism, our TSH is elevated, but our T3 and T4 are normal. Subclinical inflammation can be identified by C-reactive protein tests, but there's no obvious symptoms. And that's specific to C-reactive protein is specific to inflammation or widespread inflammation. Prediabetes, we already know that if we have a slightly elevated A1C, that although it's not a formal diabetes diagnosis, we already have, some indicators that are saying, hey, we need to make some changes. And sometimes the doctors will put you on medication for subclinical or pre-diabetes. One last one that we do in our office is a subclinical autoimmune test. And that's in many of those cases, it's women, they come in with symptoms, lots of symptoms, but the labs at the doctor's office are showing negative results or no clinical problems. It's those lab tests coming back normal, but you don't feel well. And many times it's the beginning of a subclinical autoimmune disease. And it's not clinical yet, so you may not have an ANA result. You may not have a clinical diagnosis because it's not quite there yet. And I'll mention with the autoimmune specifically, many times in women, we'll have a diagnosis of an autoimmune, or we'll have no diagnosis. The doctors can't find anything wrong, but we know something's wrong. And what it's happening is our body is creating or developing inflammatory responses, and what happens is the immune system goes, wait a minute, I know there's a problem, there's something going on here, there's an invader, I need to take care of it, so it creates inflammation. Now, that invader could be a food sensitivity and a food particle a large food particle that hasn't broken down, getting into the bloodstream. It could be inflammation from prolonged stress events, or not managed stress, or low-level stress over a long period of time. There's a lot of different causes, but the body goes into an inflammation, and then it's looking for something to attack. Well, for women, it creates, both men and women, the body creates this, an antibody, trying to find what it is. And the antibodies are out looking for what's causing this inflammation, what's causing this problem. With men, usually within a year, they get diagnosed with an autoimmune disease if that has been an ongoing issue. With women, on the other hand, our body sloughs off the antibodies and says, wait a minute, don't kill it, it might be a baby. And so we'll keep the antibodies for a short time and then it'll slough off. And so people that are having a pre or subclinical autoimmune, for example, might have a positive ANA one time they test and a negative ANA the next time they test. Well, this is a key piece of information. If you notice that you're back and forth, you probably have a subclinical autoimmune. What that means is that the antibodies haven't figured out what the problem is. And so they are starting to look for weaknesses in the body. Those weaknesses might be your thyroid, it might be your spinal cord, it might be your connective tissues. Many times it starts with the connective tissues where there's inflammation because of not resting well or stress. And so we end up with a diagnosis of something like fibromyalgia, which is a autoimmune issue, but it's subclinical. They can't decide what it's attacking yet. So it's not a full-blown autoimmune issue. But we don't want to wait until it's a full-blown autoimmune issue. We want to catch those symptoms early, and that's where holistic health can come in. We can actually identify subclinical autoimmune and start working on getting those symptoms under control and fixing that automatic response in the immune system. And that explains why subclinical issues matter, right? This is where holistic care shines, helping people feel better and avoid future health problems by acting early. If we can find those subclinical, listen to the early warning signs, listen to our body, we have an opportunity to prevent a disease. We can also explain things like unexplained fatigue, brain fog, and mood issues. These are really huge pieces that can be repaired before disease sets in. And these are symptoms of early or subclinical issues. And eventually they become disease. But I will tell you this, and I've had clients do this. They'll go to their doctor after we've done our testing, and all of our tests are subclinical tests, right? And they'll go to the doctor, and the doctor will say, you don't have any of these things. But the reality is we're not testing the way the doctors test. We're testing the subclinical stuff. Now, if you come to me and you have a clinical diagnosis, be aware that it's going to take longer to heal that clinical diagnosis than it would if you can catch it early and prevent a clinical diagnosis. Clinical being, as I said earlier, the ability for a lab to identify a specific dis-ease, okay? So if you come to me with a clinical diagnosis from a doctor, then our intervention is going to take much longer to heal. It's still doable. We can still heal you, but that intervention takes longer. It's so much better to come when you're having little symptoms that we can actually start working on before we have a full-blown diagnosis from our doctor. So a little information about our holistic approach. We don't ignore these signs, these little pieces of information, we listen to them. Holistic care takes cues seriously, and we create a personalized situation to support you because everybody's different. In holistic health, subclinical signs are seen as our little early messengers to tell us, hey, something's wrong. And the goal is to restore balance before we have disease. Now, that doesn't mean we can't help with disease, but the key piece is catch these things early when you see the first tiny signs before you go into a full-blown disease. We'd really love to keep you healthy instead of have to fix you when it's over with. So how do we do that? So instead of treating the surface level problems, we dig deep. We dig deep to uncover what's really driving the problem. So we ask question, why is this imbalance happening? We're looking for root causes. We look at your nutrition. We look at your stress level. We look at toxins. We look at infections. We look at your lifestyle. So for example, a subclinical thyroid issue may be due to gut dysfunction or adrenal stress. And many times we have to start because if it's long-term stress, if it's toxins, if it's poor nutrition, if it's an infection that you've had for a while, or even excessive use of antibiotics or steroids, these things can create gut dysfunction and overall body stress. So we have to look at all those pieces and dig really deep to find root cause. And once we find root cause like gut dysfunction or adrenal stress, we can then address those things through nutrition and diet and some supports with supplements as needed. All right. So every time we treat someone, every time we assess someone, it's very individualized. And this is why it costs so much for people to do natural health, because first, the insurance isn't covering it, and the types of individualized work that we have to do is really, really specific to the person, and every person's subclinical issue looks different. No single, I can have twins come in, and I share this story a lot. I can have twins come in with the identical twins with the exact same symptoms, and yet they have their own unique physiology and their own life context. And so we have to look at each of them individually, and how we treat one will not be exactly the same as how we treat the other, even if they have the exact symptoms and they're identical twins genetically. We will still have to treat them different because their lifestyles are different. What they've been exposed to may be different. Their physiology, even if they're identical twins, will be somewhat different. So our symptoms aren't dismissed, even if we have labs that say we're normal. I will, as a practitioner, or any practitioner doing holistic health, is going to listen for the story behind the symptoms, because that story tells us a whole bunch of additional information that labs can't see. And we create personalized care plans. They're very specific to the individual. And even then, when we're doing treatments, if we're doing treatments with a bioscan device, or if we're doing treatments with auricular medicine, every time we do a treatment, we're treating differently according to where you're at in that moment, so that we can get you to a place of balance. And that's the whole point. I did want to talk a minute about story. Let me do that. Let me talk about story. I'm going to make myself a little bit bigger so you guys can see me. I'm going to talk about story for a minute before I move on to the lifestyle and nutrition. So story. One of the things that I encounter a lot is I ask you to, if you're working one-on-one with me, I ask you to fill out this really long, extensive, exhausting form, right? The health journey form. And I'm asking a lot of questions. And then I have a meeting with you for an hour at least, and we talk more about everything there and ask more questions about your life journey and your health journey. And one of the things that most people don't realize is that story is like a key piece for me, because have you had long-term caregiving, or done caregiving? Have you had some type of a traumatic event? Maybe you don't even remember. Maybe that traumatic event was early in life. Maybe, and this is something that most people are not aware of, maybe your mom's gut health wasn't great when you were born. Maybe she had stress or other situations. Recently, somebody said their mom was really sick before she was born, like 2 months before she was born. And so when that happens, if you can imagine that this is the level of mom's health when mom is born, but by the time you're born, her level of health is here, you start at her level of health, which means that now you only have opportunity to continue to go down. Your health gets worse. So you're starting off as a deficit, And now, as you're getting older and things are happening in your life, your health is going down. So instead of you starting off up here with perfect health, you're starting here and you're already having an issue and you don't even know it because the symptoms aren't there. That's where subclinical comes in. We can identify things before symptoms start because who wants to have a symptom, right? All right, let's talk a little bit about lifestyle and nutrition. So we like to start with foundational practices, nourishing our body through food, through gentle support tools, making small changes because they can make a big impact. So we look at our food as medicine. Now we might make you a supplement or recommend a supplement that will support you while you're trying to get healthy. And we try to do that or help to speed your healing process a little bit faster. Those things are important. So, but we want to have food as our medicine, right? We want to support anti-inflammatory diets, support blood sugar issues, support nutrient deficiency or sufficiency. And we will, in many cases, incorporate some herbs and adaptogens like turmeric or ashwagandha. And so we really, though, want to get you to a point where food is your medicine. And so while we might support you at the beginning with some herbs or some supplements, we want to get you to a place of health so that you no longer need that, so that you're absorbing your nutrients through your food properly and your cells are absorbing the nutrients appropriately so that they can utilize it to give you energy, to give you health, to give you well-being, to remove what little symptoms you might have. One of the things that we find a lot of times is women with really serious health imbalances. They can't figure out what's wrong with them. We find that they are really dealing with the cell level issues. And so treating cell level energies help. And usually within 3 to 4 months, if we catch it at a subclinical and they don't come in with a full blown diagnosis, within 3 to 4 months, they're noticing a really noticeable improvement in their energy level from day to day. And so that's very helpful. But again, if you come to me with clinical diagnoses, that's not going to happen in a few months. It's going to take more time because you have waited much longer. Many times our health is directly affected by long-term ignoring of those issues that we should have paid attention to when the body began to whisper. We want to start listening to our body. It whispers. It says, hey, I don't feel so great. Listen to the whispers because we can fix it when it's whispering and we can fix it quickly and we can bring balance quickly. So that's what we want to do. I'm going to move myself back over here so you can see my slide again. So Dr. Berry, what do? You talked about a whole bunch of stuff. Well, we use all kinds of tools, okay, that help us see what's happening behind the scenes. They're especially helpful when symptoms don't align with conventional results. So if your results say everything's fine, but you're still feeling bad, if the results say you've got something, but you don't have, you don't feel it's accurate, we can look for those subclinical issues. So some of our tools may look like a food sensitivity test. We pretty much ask everyone to do that at the beginning because that helps us know what's creating an inflammatory response so that we can avoid those foods while we're healing the gut. Because the more that our gut is inflamed, the slower it will be to heal. So we kind of do that. We might look at cortisol panel to see what your cortisol rhythms are. You'll do a urine test 4 times a day in a 24-hour period. So we can identify, are your adrenals sufficient? Are they all messed up? Is that why you're up in the middle of the night? Okay. We will almost always, I do a biofield assessment, and that's our BioScan SRT, and I'll talk a little bit more about that in a little bit. But The biofield assessment, we might do micronutrient testing. That's usually a blood test. We will do an autonomic response test, which has to do with feeling your pulse while we're incorporating different items into your energy field. And we might do frequency specific micronutrient or microcurrent testing, which is we do on the ear. So there's a lot of different types of testing that we can do that find those early whispers of the body being out of balance. It's really, really important. We also really look at the whole person. We don't just look at, a lab result. Our whole person healing is physical, mental, emotional, and spiritual, and these are all considered. What appears as a physical imbalance most of the time has some type of an emotional or energetic root that makes that imbalance. Holistic care, we embrace all of these levels of healing because they're important. You don't just come to me with a physical issue. You come to me with past mental or emotional stuff that you've brought, that's baggage or luggage that you bring with you. There are spiritual things that we also consider. Now, while we don't specifically tell people what their spiritual need is, usually that will come out as we work through getting you healthy. So some of our practices may include meditation, mindfulness, somatic therapy and breath work for vagal nerve responses, energy healing, which we talked about earlier. We'll talk a little more about auricular medicine, where we test the ear for different energies as well as treatments, and chromotherapy, which is color therapy. One of our primary therapy routes for autoimmune is wearing some specifically colored glasses for that. Or if we're dealing with stress or anxiety or panic, we have a specific colored glasses that help with that. And you wear those at home. You put them on as you need them, and or for your treatment. So we have some odd things that most people don't think about, but these things really help at the root and help with the root causes and help with the energy of the body. So subclinical signs are not just red flags. They're actually an invitation to stop, to listen, and to act. So a holistic mindset says subclinical equals opportunity, not subclinical means I'm getting a disease. Okay? When I say you have an autoimmune concern, it's subclinical. I might say, you know what? Your adrenals are not functioning as optimally as they should be. You don't have Addison's disease, which is the disease of the adrenals when they stop working. What you have is your adrenals are not working the way they should be optimally. And we test that with a positional blood pressure. You can do that at home and identify if your adrenals are in a fatigued state and not working as optimally as possible. So rather than wait for a disease, right, we want to seize the moment. Let's find a way that we can correct the course or the trajectory of your current direction that your body is going, and nourish your system so that you can get back to wellness. So a little change here will change the trajectory. So if you keep going this way as you're going, you're getting to disease up here, right? But if I make just one small change, it changes the trajectory. If I make two small changes, it changes the trajectory. So we have less opportunity to have disease if disease is up here. So we need to make those changes early on, right now. And that's what we do in holistic medicine. So some final thoughts. Subclinical signs are a valuable early indicator. They are an opportunity to jump in and do some trajectory changing. Holistic care responds. Holistic care responds. I respond with curiosity, with compassion, and customization. We are not just a standard of care, okay, which is what the medical world does. They do standard of care, and that means what that means is when you come in with symptom 1, 2, and 3, the doctor says this symptom, okay, we're gonna give you this medicine, and if it doesn't work and you go in, I now have symptoms 1, 2, 3, and 4. They say, well, I think that's this. And so we're going to change it to this medicine or add a medicine. Pretty soon you're on 3 or 4 or 5 medicines. And some of those medicines are giving you side effects. So now you need another medicine for the side effect, all because you had these symptoms that they diagnosed as a clinical diagnosis. Well, before we get there, let's do some natural healing, some holistic healing. Let's customize it. If you come in with high blood pressure and it's diagnosed and you're on medication and it's not getting better, let's talk about what we can do to help with that holistically. What's caused that? What are some of those root issues? Are the adrenals not functioning properly and it's been going on for years, and now we've gone from low blood pressure now to high blood pressure, which is what happens. That's a process because our adrenals are burnout. And so what do we need to do to fix that? And we fix that through customizing our health plan and our care plan. Our goal as a holistic provider is to heal things before they break down so that we're thriving and not just surviving. And so I thank you for joining me today. I hope that I've left you with some inspiration and understanding of subclinical health, that it's not a gray zone, not as much of a gray zone as most people think, but it's a really powerful gateway to healing and to preventing disease. Thank you so much for being here.